Okay. We've started and we're welcoming in our guests.
Fantastic.
Hello and welcome everyone. We're just letting folks join and welcoming everyone in from the waiting room. It will be just a minute or two before we get started. Just a quick note here as we get settled. Feel free to type your questions into the chat. This recording will be a live webinar that is recorded and we will be sharing after the fact on our website. Thank you so much.
We're just going to wait for another minute. I think we'll start at 9:32 or 33.
Hello and welcome. Before we begin, I just wanted to say a few housekeeping notes. This is a webinar format, so please note that you are muted and there are no videos for our guests. So if you do have a question, please note it in the chat. Please note that it is a recorded webinar and we will be sharing this recording on our website after the fact. Your chats will be recorded as well, so please don't share any personal information in the chats. With that note, I will hand it over to Dr. Kishore Mahapuri to open up our third annual open house. Thanks so much.
Well, thank you, Tamara. Hello, everyone, and welcome to our annual Hippy open house. And this is actually our Hippy Lab's third open house now. My name is Kishore Mulpuri. I'm an orthopedic surgeon at British Columbia Children's Hospital. I'm also professor, department head at UBC for orthopedics. I'm also a researcher with Research Institute, British Columbia Research Institute, Children's Hospital Research Institute. Before I get started, I would like to acknowledge that I'm speaking to you from unceded traditional ancestral territories of Musqueam, Squamish, Tsleil-Waututh nations. I know some of you are joining us from across BC and around the world. I would like to extend this acknowledgement and gratitude and respect to all the communities from which you may be joining today. Next. Our Hippy Lab's mission is to work to improve children's hip health and mobility and quality of life, both locally in the communities we work, and then working together with our collaborators and partners and supporters from around the world globally. And our areas of focus are predominantly, as you can see here, is children's hips, development dysplasia of the hip, which is one of the most common conditions we treat. Roughly, to give you a magnitude, at Children's Hospital, about 7 to 8% of all of our visits are related to just dysplasia of the hip alone. But if you combine all of the hip conditions, there's somewhere between 10 to 12% of all of our visits are children's hips. And in addition to that, really proud to say that we now are leading a largest children's hospital trauma study ever, supported by AO Foundation. And that study is just up and about and running now. And we're trying to convert that into a global children's fracture registry. And you will hear a little bit more about that in our presentation. So if you want to learn about these conditions and you're new, you don't know what these conditions are, the videos that talk about these conditions are there at amahippy.org. Feel free to browse that website and learn about those conditions. Next. And really our approach is, and you will see throughout the presentation, it's the approach of local to global. We really want to, when you talk about global, we forget that global includes our own community, it's our own backyard. And so we really need to work in trying to improve the care in areas in which we're focusing on. And again, you will see an example of our hip surveillance program with children with British cerebral palsy. We started the program here in British Columbia, still happens to be the first and only program of its kind in North America. We've eliminated children having hip dislocations with these conditions altogether, but we now are helping other provinces and helping other organizations and other countries around the world for them to develop their own care pathway. And that's one example of local to global. But this back to local, recently, we have helped India develop their own care pathway for development dysplasia of the hip, but we actually don't have one in BC and Canada. So we're now taking the learnings that we have from our work with India, bringing it back and developing those care pathways in our own backyard. So often when we think about global, we think we're giving something to someone, not getting anything in return. I would humbly submit that any of the work that we do globally, we gain a lot from it, we learn a lot from it, and we bring a lot of those learnings back locally to help us to do what we do. Next. This is the amazing team. Mind you, we don't have everybody here. We have a lot of transients that come and go, and they go on to bigger and better things. There's a lot of people that are in the medical school pursuing their own research degrees, people that have gone into all sorts of professions, into psychology, nursing, engineering, you name it. But we're fortunate that all of the work that you see is actually a combination of these people. We have, in this group, we have nurses that work in this hospital, we have PhD scientists, we have students, we have therapists, you name it, and every single person is represented. It also gives you a glimpse of how diverse this group is. And the group is really strong because of the incredible diverse input and thinking that this group brings to making this happen. Next. And it's a growing network of our really, the biggest asset that we have is our fellowship program. I was fortunate enough to take over as a fellowship director in 2007, and we had about 2 fellows that used to come, and most of the Canadians used to go to different parts of the world to train. And we are now become the #1 training program for Canadians, and we've trained about 5 times more in the same time period than SickKids Toronto. But we have gone, once we go beyond Canada, you can see we don't have preferential fellows that we take from 3 or 4 countries like many other programs do, either from England, Australia, New Zealand. We really are trying to be global. And if you look at our current set of fellows, we have a Rwandan that's working with us. First time ever someone has stepped out of Rwanda to have a formal 1-year fellowship training. Same thing last year, we had someone from Uganda, and the year before we had someone from Kenya. And that is really the testament to, I think, our BC Children's Hospital, UBC's involvement, teaching and training. And we learn a lot from these people. Next. With this, I'm going to pass it on to Emily Schaefer, our PhD scientist, research director for our Hippy Lab, as well as for pediatric orthopedic division and department here at BC Children's Hospital. Emily joined us about 8 years ago, and she has really been a catalyst of a lot of the work that we were able to do globally, which I would humbly say, if you go to this network called expertscape.com, the top 2 experts in the top 10 on the development dysplasia of the hip come from our research institute and our hospital and our program here and our university. So with that, I'll pass it on to Emily.
Great. Thank you so much, Kishore. I mean, thank you so much for your incredible passion and leadership and guidance of this team and making it what it's become, what we're going to be able to talk about today. And the work that you're going to hear about now is me speaking, but it's due to the incredible dedication of our entire team and our many collaborators. every single team member we have makes invaluable contributions to making us successful. So thanks to our coordinators, our managers, our co-op students, our volunteers, our clinic team, and the list just goes on. So a major focus of our work centers around global research registries to examine specific pediatric orthopedic conditions. So what is a research registry? For those of you that aren't familiar, registries gather data. In our case, it's both clinical and patient-reported data from participating hospitals. So the intent of the registries that we run is to provide data, high quality data, that can help advance not only research, but also clinical care, education, and advocacy. On the scale in which we conduct our registries, we also aim to impact global health and drive innovation with innovative and with new partnerships with industry, as well as with other collaborating educational and teaching centers. So out of this, the Hippy Global Registry Program was born with a mission to improve outcomes and the quality of life for children and families, not only here in BC, but also around the world. This program is growing. We have 2 really well-established research registries underway with GHDR and SLIP, shown here at the bottom, as well as 3 more registries in development that are ready to roll, or going to be ready to roll out completely in 2023, which is very exciting for the year ahead. Whoops. So the scope of these registries has become truly global, with collaborators from hospitals and universities the world over. This slide really gives a snapshot of all of our different collaborating institutions, and we're constantly looking to improve our global representation. It's truly a privilege to work with our wonderful collaborators, especially importantly, including the vital contributions of our participating patients and families. So our founding registry in the Hippy Global Registry Program is the Global Hip Dysplasia Registry, or GHDR, which aims to optimize treatment and outcomes for infants and children with DDH worldwide. So to date, we have over 5,400 patients recruited across 40 centers from 11 countries and 5 continents, which is a truly remarkable feat by everybody involved. Some important GHDR updates for 2022 include a name change. So those of you who have attended past years of our open house may recall us talking about IHDR, or the International Hip Dysplasia Registry. We decided this year to make the change to Global Hip Dysplasia Registry, or GHDR, to more closely reflect our values of true global inclusion in all of the work that we do, and especially in our research registries. 2022 also saw us hit some amazing recruitment milestones. We passed the 5,000 patient mark and still counting, are now over 5,400 within the year. And this is globally, but we also surpassed 1,000 patients recruited right here at BC Children's Hospital, which is an incredible testament to the patients and families willing to contribute to the research process, as well as the incredible hard work of our co-op students over the years that have done the bulk of the recruitment. We're also in the process of launching the first randomized control trial, or RCT, performed within the auspices of the registry, which we are excited to roll out this year, and we have also begun a new collaborator engagement initiative, but with the formation of registry subcommittees to help with the running of our research registries, like publications, membership, and communications. So our next registry is the SLIP registry, or the SCIFI Longitudinal International Prospective Registry, which is aimed at determining optimal treatments for children and teenagers diagnosed with the hip condition called SCIFI, or slipped capital femoral epiphysis. To date, SLIP has recruited over 350 patients across 36 centers from 9 countries and 5 continents. So this year, SLIP continued to gain momentum surpassing that 350 patient mark as mentioned. We also have an updated logo as part of our branding, our new branding of the Hippy Global Registry program. And similar to GHGR, we launched our investigator engagement initiative and launched our subcommittees. A really exciting new registry, which is both a Hippy and International Limb Differences Network registry, is Global POISE, which stands for Global Pediatric Orthopedic Implant Safety and Efficacy Program. So many orthopedic injuries and conditions require implants to fix fractures or properly align bones, and therefore understanding how safe and effective these devices are is critical. So our incredible postdoc, Bryn Zomar, is leading this project on the Hippy Lab side, and we have partnered with Dr. Tony Cooper and his International Limb Differences team to develop this registry. And our two teams are working in partnership with OrthoPediatrics, which is the main manufacturer of orthopedic implants for kids, to develop this global registry, which is aimed at understanding the outcomes of these implant devices and how well they're able to do their jobs and their safety profile. And we're excited that this is underway. We've started recruiting here at BC Children's for this study and are aiming to roll out in early 2023 for centers around the world. And our postdoc, Bryn, is also spearheading the development of Global Ped Ortho, which is a pediatric, as Kishore actually spoke about in the beginning, a pediatric musculoskeletal trauma registry. So this Global Ped Ortho is an expansion of the existing trauma registry that we run in partnership with the AO Foundation in Switzerland. And what's really important about looking at trauma specifically, or traumatic orthopedic trauma in kids, is that kids' bones are unique and have a great capacity to remodel after injury, unlike adults, and therefore they need to be treated uniquely. We hope this registry will provide us with high quality data to help us understand the best way to treat certain fractures, particularly in cases where there's been a lot of debate over the best method to take in children. And finally, the third registry that we're looking to launch in 2023 is the Rare Hip Conditions Registry. A lot of the groundwork for this has been done by one of our current co-op students, Sheila Lamb, and she was building upon some amazing work done by our research coordinator, Ashley Munoz. You've heard today about some of the more common pediatric hip conditions, like DDH and Skiffy. We will talk a little bit later in Perthes and hip displacement and cerebral palsy. But there are actually many, many more, much more rare conditions of the hip that affect kids as well. But due to the relatively small number of kids that tend to be impacted by these conditions in any given area, it's historically been difficult for individual surgeons or researchers to really understand how to best treat these kids. And so using our global collaborations, we want to work together to better understand the natural history, identify optimal treatments, and identify or improve outcomes for these conditions. And shifting gears to another major area of focus for the Hippy Lab, but it has stemmed naturally from our registry program and the collaborations thereof, is the development of care pathways. And so a care pathway uses the best medical and research evidence to standardize or essentially create a map or an algorithm for the diagnosis, management, or treatment of a given condition. And this figure up here on this slide shows what can be a relatively complex care pathway. This is one such care pathway for hip surveillance and cerebral palsy. So our team has had the tremendous pleasure and privilege to play a supporting role in the development of two care pathways in India, one for DDH and one for surveillance of hip displacement in children with cerebral palsy, or CP. Our master's student, Jackie Lee, took on this project with incredible energy, and working together with Dr. Alaric Regis. Al is one of our frequent collaborators, and he's a pediatric orthopedic surgeon from Mumbai. So led by his incredible passion and energy, which is unmatched, the Pediatric Orthopedic Society of India, or POSI, brought together 7 national healthcare organizations to build the DDH care pathway and 8 national health organizations for CP hip surveillance process. And these collaborations represented over 120,000 healthcare practitioners in the country. And over a year-long period, experts from these organizations work together to develop care pathways that take into account the local healthcare system, as well as the resources available in India. And this work culminated in a 2-day summit in Mumbai in July to discuss implementation and knowledge exchange to put the pathways into action and to help improve early detection and treatment for all children in India. And as we move forward with our care pathway model, we have adopted a pay-it-forward approach for this care pathway work, whereby a key leader from previous care pathway project acts as a consultant in another region's process, continuing the progress forward in different regions. This model is in action as we speak, as the aforementioned Dr. Arujis is lending his expertise and leadership to a Sri Lankan expert group to build a similar care pathway for Sri Lanka. So led by Dr. Sunil Vijayasinghe, 3 national organizations in Sri Lanka are currently developing a DDH care pathway that's specific to the Sri Lankan context. And this work has been supported both by Al and our co-op student, Denisha De Silva. Now, having been a part of these global care pathway processes, we are now in the process of bringing lessons learned in these global endeavors and applying them locally here in BC. So Dr. Anya Smith, a Hippy Lab team member, is leading efforts to develop a provincial hip screening program for DDH here in BC. She's leading 4 ongoing projects that are directly in support of this work, including doing a systematic review of existing screening programs, and looking with the help of co-op student Trevor Fowler, taking a look at how far families are currently having to travel in BC in order to access screening and care for DDH. So we anticipate that when we move forward with this program, the development of it will reduce travel times and costs for patients and families, as well as free up healthcare resources, but above all, will improve outcomes for patients and families. And looking ahead for future pathways, we have 4 additional projects that are in the initiation stage, which is really exciting to set the stage for 2023. We're in the early stages of a national care pathway for Canada, and we have made some initiation of conversations to start the process in Colombia, China, and Brazil as well. And so this care pathway work has been infinitely rewarding to support groups in other areas, and now take it back into our own backyard, really bringing the local back from our local to global, back to local. Another huge component of the Hippy Lab team is the wonderful and amazing clinical care team who tirelessly provide patients with fantastic care. A vital component of this care for our patients with cerebral palsy and other neuromuscular conditions in particular is hip surveillance. So kids with cerebral palsy are at particular risk of developing hip displacement. And hip surveillance is the process of monitoring and identifying critical early indicators of developing this displacement in order to provide early treatment and avoid more complex surgery with worse outcomes. The Child Health BC Hip Surveillance Program for children with CP is a program developed and led by our absolutely incredible physiotherapist, Stacey Miller, and all credit to her for the amazing work done on this program. This program aims to ensure that all children at risk for hip displacement are screened in a timely manner and receive appropriate care no matter where they live across the province. Having celebrated its 5th birthday last year, the program has seen enormous success at reducing the number of salvage surgeries required. The salvage surgeries here shown here in yellow, in the yellow bar, From 2008, they were making up over a third of the surgeries done, to 2021, we're making up just a very small percentage, under 5%. And these salvage surgeries are usually done as a last resort to reduce pain and discomfort. And instead, the team has been able to intervene earlier, increasing the number of preventive and or reconstructive options available for kids. In relation to this HIP surveillance program, Anya is also leading some population level work using provincial data to estimate the prevalence and incidence of CP in BC's kids, so across the entire province. This work will help target recruitment into the surveillance program to ensure more kids are seen and monitored, and will also collect data for ongoing population level surveillance. An important next step to expanding this program. So those are an overview of some of our major ongoing programs, but there's so much more going on behind the scenes with our incredible team members and collaborators at an individual study level or smaller program level. Just to give some broad idea of the highlights during the academic year of September 2021 to August 2022, our team published 20 research studies in peer-reviewed journals and had 30 presentations at academic conferences, which included storming the pediatric sessions of the Canadian Orthopedic Association annual meeting in June, where we had 6 podium presentations and 8 posters. We also have an extremely busy research pipeline. We have 68 studies that are currently at varying stages of the research process, from ethics to publication and any stage in between. These studies span a variety of research methodologies, with a few randomized control trials, to prospective cohort studies, retrospective studies, and to a number of scoping literature reviews. They also cover an extensive number of topics. So DDH, Perthes, trauma, some of the conditions you've heard about today. But particularly prolifically, I want to highlight next studies related to cerebral palsy and other neuromuscular conditions. And that is because, as I spoke about, our CP clinic team is prolific in not only their providing excellent clinical care, but their research output, with numerous studies on the go. It include looking at unilateral versus bilateral hip surgery in patients with CP, as well as orthopedic complications in children with Rett syndrome, which is a neuromuscular disorder. So Perthes disease is another area of focus for our team. And our Perthes work is really led by our engineering PhD student, Luke Johnson, and his supervisor, Dave Wilson. So Perthes is a condition that results in the death of bone cells in the femoral head, or the ball of the hip joint. And this can lead to changes in the shape of the femoral head, which can cause hip pain and osteoarthritis and necessitate the need for a hip replacement in early adulthood. Luke's research is using shape modeling and advanced MRI imaging techniques to allow him to look at cartilage health in these patients, as well as to better understand what different sorts of hip shapes that can be caused by Perthes cause poorer outcomes for Perthes patients. And this is a really exciting area of research that Luke has brought to the team to be able to look at this aspect of it. Another area that we're extremely excited to be exploring is the application of artificial intelligence or machine learning processes across our research. It really applies across all of our research. Currently, we're working with 2 wonderful UBC orthopedic residents, Yusuf and Naif, to perform some machine learning proof of concept studies to look at how to automate X-ray image classification and measurement in our DDH patient population. We also have a medical graduate, Bobak, doing a scoping review of the current landscape of AI in orthopedics. And we have some ongoing collaborations with engineering team at UBC, led by Tony Hodgson, looking at other aspects and other facets of imaging, particularly around ultrasound for DDH. So this program holds so much promise to improve research efficiency and accuracy. And this is critical with the size and scope of our global projects that we have. And so that will be a major focus of ours going forward to continue to push the boundary of the research that we're doing. And combining sort of all facets of our team's mission, we have the Hip Hope Network, which is the Hip Health Outcomes in Pediatrics Network. And this network was founded a few years ago now, but has been slowly building. This network aims to bring together global experts to improve hip health, mobility, and the quality of care for children with hip conditions worldwide. The network is founded on 4 key pillars: community, research, professional development, and growth and outreach. Each pillar has a team of co-leads that were spread across the globe. Myself and Dr. Woody Sankar, an orthopedic surgeon in Philadelphia, co-lead the research pillar, while we have Dr. Al Arugis and Dr. Salil Opasani leading the community pillar, Dr. Pablo Castaneda and Dr. Ben Shore leading the professional development pillar, and Dr. Pradisha Moreno and Dr. Pranay Budev leading the growth and outreach pillar. But we also have key members of our team helping to push this forward, and but really, truly, the energy behind pushing this network forward is our global hip health coordinator, Tamara Dudley, who has put in an amazing amount of time and effort to see this launch, along with our managing director, Joel Sloan, to see it come into fruition as what we saw in May. So back in May, the Hip Hope Network had its first official kickoff with its first in-person and hybrid meeting in Vancouver, where we had about 150 people attending from around the globe, either both in person or virtually joining the cause. Our Hip Hope Network work has also brought us to connect with hip health experts and advocates worldwide. We now we held our second International Hip Health Day back in June, where we honor hip legends, which are orthopedic surgeons, hip health advocates, you name it, people who have truly made an impact on hip health for kids worldwide. And that brought us to connect with a hip legend in Nancy Muir, who's a physiotherapist in Colorado. And she runs the advocacy group Miles for Hips. And she actually made a visit to our team in the summer. And we intend to have future collaborations going on with her. So this is just one way that the Hip Hope Network is starting to bring people together globally. And the Hip Hope Network invites you to join us on our mission to reduce the burden of pediatric hip conditions globally. As we are a growing global network of hip health professionals committed to improving global hip health. And we, with our mission is to have a future with a solution for every hip challenge. Okay, and moving back to sort of some wrapping up overall for the Hippy Lab, we're thrilled to announce with the Hippy Lab the kickoff of our new lab website. So please do check us out here. It has just gone live and will be a work in progress, but is our first iteration is ready to be viewed. We also have, led by Tamara, really kickstarted our communications, which our team is striving for providing accessible updates and communication through digital abstracts. So we're trying to sort of condense our research studies that get published down into digestible bites and put on social media as in the form of digital abstracts, as well as engaging videos and informative videos, social media, and annual reports. And looking ahead, we anticipate an extremely exciting year of advancement of all of our different research studies and collaborations and programs. And for that future focus, I will hand it back over to Kishore to wrap it up.
Thank you, Emily. And I'm truly humbled, actually, when I look at either our report or when we do this annually, about the amount of work that this amazing team does to, really, again, going back to improving care here locally, but also our impact globally. Our big focus, as Emily said, is going to be on artificial intelligence. And I think that's really important. We have huge databases here. And for anyone to build any AI algorithms, that what you need is data. Probably not a week or 2 weeks goes by without someone reaching out to us wanting to work with our databases. So we're working with our collaborators here at UBC and around the world to see how we can actually improvise and improve some of the data that we have in that can lead to ultimately improved clinical care. So that's going to be a big focus for us next 3 to 4 years. And one of the questions that we've been asking ourselves really hard is, really, are we doing research that's relevant to patients? One of the things that we're working on is coming up with some non-operative options and braces for children with development dysplasia of the hip. We've done a large survey that spanned across many different countries. And what came out really clear is some of these braces that we're using in patients for over the last 40 years, the parents are not happy. It's not doing the job that they expect them to do. And same holds good for a lot of the time when we come up with research that we want to answer, there's very little patients and family engagement. And that's going to be a focus for us. And most of our, whatever we do is going to be informed by patients and families. And we really want to look at how we can engage them in our research and our educational efforts. And the care pathways, it's really, really important in that we need to bring together some congruence to how we do. We are about 7 orthopedic surgeons here. We now have only 3 people that predominantly do hips, but there was a time there were 5 of us that were doing hips, and all 5 had very different ways of doing it. There's nothing wrong with that, but often when patients go from one surgeon to another, it's incredibly confusing for them as to why we're so different in our approaches. That's because we haven't really all sat together and thinking about what's the best way to care, best way to bring efficiency to our system, and best way to minimize late diagnosis, which leads to bad results. And to really then talking about patient engagement and our impact, the one that I'm most excited about is that I've had a great meeting with head of UNICEF in India, and they have their largest operations for UNICEF in the world is in India. They have about 500 people that work just in their health sector. So we're trying to see if we can get DDH screening on their agenda. So I've had a great preliminary meeting with them. And that's something, if we're able to do that, we're able to probably use UNICEF and WHO for a lot of the work that we do. So incredibly excited about that prospect of where things are going. But next slide. Next, all of this wouldn't be possible with all of the incredible partners and families and that actually support the work we do. I think they're the number one that we need to recognize, is that they know that sometimes the research or the outcomes we're collecting may or may not improve their own child, but they're actually contributing to improving science, helping somebody else for the future. And that is something that I'm incredibly grateful for. And I see some of our leaders, hospital leaders that are on the call. If I miss anybody else that's on, my apologies, but I see Christy Hay, who is our executive director, and Leanne, who's our director for the area we work in. And they have a lot going on now, as you know, with RSV and everything else. They've taken time to be here. There's several others that have sent their regrets and that are going to be watching our recording. Without their help, it's very difficult to navigate, I think, this work. And even though they know the clinical demands on the system are high, but they truly support teaching, training, and research. And I think without their support and help and the university's infrastructure, we would not be able to do what we do. As you all know, and we have Regina here and Martin representing I'm a Hippie, they actually gave us the real belief that we could take on such a huge endeavor to really organize children's, I would say, hip health, not just here in BC, but around the world. It doesn't matter which university you go to, you talk about children's hips, they will recognize our center here in British Columbia as the center that's leading a lot of these efforts. And several other organizations here that you can see. I see Mark here, one of the high up ranks in orthopediatrics. Mark, thanks for joining us. And we're really excited about the partnership we have with your company, whose vision also is to impact every single child around the world, whether you're in those markets or not, which is quite exciting to see for a company to have that kind of a vision, to have a broader impact. And there are lots of individual donors. And I think the most heartening thing that I've ever seen was there's a child once walked in with a plastic bag with lots of loonies, toonies, and all sorts of different denominators. And that child did a lemon stand 4 times in the summer to raise $73 and came and gave. And that every penny that somebody has ever given our team is really going towards improving hip health around the world. So, and there are many others that we have not acknowledged here, but we're truly humbled and honored that you trust us with the work we do. And without your support, there's nothing that we won't be able to achieve. So incredibly grateful for your support. Next. And with this, I'm going to hand over to Martin Shen, who is on the Hippy board, and he's going to give us a little update from I'm a Hippie. Thank you, Martin.
Yeah, thanks, Kish. Thanks, Emily. It's obviously an honor and a privilege to be here to talk to all of you. Every year we listen to this, and it's just amazing, Kish, to kind of reiterate what you said, the amazing amount of work that you guys do. And the fact that you've really have gone global with everything that you've done, it's so impressive. So certainly I can speak on behalf of the board of I'm a Hippie. We are so honored and privileged to be supporting this cause. And Kishore and Emily, your leadership is amazing, but your entire team here at the Hippy Lab, just very impressive work. As you may or may not know, the I'm a Hippie Foundation had a record-breaking year as well. We raised over $1 million at the gala, which obviously just goes to fund all the work that you guys do. And there's a few groups, I know you've mentioned some of them, the Peterson Group, the Monday Family, Inner Gulf, Oak Ridge Montessori, Mana Industrial, and Steel Industry Group. We just want to mention those particular groups because they're amazing. But then everybody, Kishore, like you mentioned, the kids with the lemonade stands, but all our friends and families that have gone to support I'm Hippie, and what hopefully the message is about, really helping relieve that burden of any hip injuries that kids might have. So we are very honored to be part of it. We're grateful to be here, and we look forward to what all of you can do in the next year and years to come. So thank you so much.
Hey, Kishore, we want to say a last wrap up. I think you're muted.
Kishore, you're on mute.
Yeah, no, going with the Montessori story that Martin talked about, there are 2 Montessoris, bilingual Montessori and Oak Ridge. And the little children of those Montessoris every year raise each more than $10,000 to $15,000. So we get about $30,000 raised by 2 children's Montessoris in Vancouver. So that it really goes to show you the kind of grassroots support that our team has in supporting the work we do. So here is, if you want to follow our lab, and here are some of the links. And we're really grateful again for you all showing up today. It's you're all incredibly busy with different things that you're involved with. We sincerely appreciate your support. With this, I'm going to open the floor for any questions or comments that anybody's got.
I see Christy, you've raised your hand. Go ahead.
Thank you so much for the presentation and all the amazing work that you do and continue to do. I'm going to take this opportunity to actually wish Kishore a happy birthday. It was his birthday yesterday.
Thank you.
And so just wanted to, often meetings where people have had birthdays, everybody sings happy birthday, but
Oh my
I will
God.
spare you that. But yeah, just to raise my hands to you, Kishore. Really, really privileged working with you and your team.
Well, thank you, Christy. I'm humbled, honestly. The passion, I think, with everybody that's involved with us is, I think, what keeps it going. Everybody it's really incredible journey for us in the last, I would say, 10 to 12 years. It doesn't matter who we come in contact with, and we've got wholehearted support from community, from industry, from our health region and our university. So we're really blessed. And the amazing team and the people that you see here as panelists, not everybody could be here for various commitments, but it's actually these people's amazing work, and everybody goes above and beyond to do the work. And often when we work with our collaborators, their calls are at 3 a.m. or 4 a.m. or at 11 p.m. And they do it without any questions. And so really, I think the people to thank is this amazing team that calls themselves as Hippy Team or Hippy Lab. Great. Any other questions or comments? Otherwise, we can give 15 minutes of your time back. Mark, do you want to say anything? I mean, it's kind of nice that you've joined us, and we've sort of partnered with your team in the last 2 years trying to get this POISE study going.
Yeah, surely. Thank you. That's really all. I mean, the work you guys are doing is absolutely incredible. We're ecstatic to be even a very small part of all the work you're doing in the service of improving what kind of data is available to ultimately have the right outcomes for children. So keys to you, the entire team that's a part of Hippy Lab. We're more than honored to be in support of all of your efforts. So thank you.
Thanks, Mark. Great. With that, everyone, have a great rest of the day, and happy holidays to you all. And we'll look forward to connecting with you very soon. Thank you.